Dr. Rochelle Walensky is the director of the Center for Disease Control and Prevention. Dr. Walensky, good morning. Thanks for joining us. We want to start, if we can, with the CDC's recent decision to cut that isolation period in half. Given that you and other public officials have acknowledged that it wasn't exclusively science, but also those possible staffing shortages that played a role in this decision, should Americans feel safe?
Good morning, Peter. Thanks so much for having me. So we followed numerous areas of science in making this important decision. One, of course, was how the virus behaves. How much virus do you still have that you could potentially transmit after 5 days? And we generally know that most of your transmission potential happens in those 1 to 2 days before you have symptoms and those 2 to 3 days after. So by the time 5 days of isolation has occurred, you probably have about 85 to 90% of all of your transmission potential behind you while you've been in isolation. Importantly, also to that decision was where we are in the epidemiology of this disease. Skyrocketing case numbers, as you have noted, we anticipate they could get even higher. And many people are asymptomatic or only mildly symptomatic, especially those who have been vaccinated or boosted. And so they may very well not be able to or willing to comply with 10 days worth of isolation. So this was really a way to tell people, make sure you isolate in those first 5 days when you're maximally infectious, and then, of course, wear a mask for those last 5 days to make sure that you don't spread anything that might be left over to others.
Well, Dr. Walensky, let's put this into real terms. Let's say I'm sitting on an airplane. I'm sitting next to someone who is masked, but who tested positive for COVID 6 days earlier. Should I be concerned that I could be exposed to COVID?
You know, certainly in those airplane corridors, you are wearing a mask, the person next to you is wearing a mask, and if both of those are true, as they should be in those airplanes, then I would say your risk of transmission in that situation is really quite low, even if that person has a little bit of a tail end of virus.
And Dr. Walensky, other public health officials have criticized these new guidelines, saying that they should include a negative test, that should be necessary for someone to be able to leave that isolation period. Why is that not included in the new guideline?
Yeah, really important question. I'm glad you raised this. So what we do know is that the PCR test after infection can be positive for up to 12 weeks. So that is not going to be helpful. You're not going to be transmitting during all of that period of time. We've seen that in study after study. So then the question is, well, why not do an antigen test at 5 days? We do know some people at 5 days will be negative and still be able to transmit. We also know that some people will be positive and still be able to transmit. So that antigen test was actually not authorized for this purpose, and its information would not be useful. Regardless of what the antigen test said, we would say you still need to wear your mask for 5 days.
Well, just following up on the antigen test, there's new data from the FDA which shows that the results may not be as accurate as initially thought. So if people are taking those at-home tests, should they have confidence that they're accurate?
Right. So we do know that the antigen test may not perform as well as it had for prior variants, the Alpha variant and the Delta variant, but it's still picking up quite a bit of infection. So a really, really helpful tool. But what we would reiterate, and is also in our guidance, is that if you have a negative antigen test and you have symptoms, then you should go ahead and get that PCR test. And those antigen tests are really helpful for things, as you just noted, on tests to stay in school, where we're getting an antigen test every day or every other day, or where they're using them in higher education to screen students every several days. That's when they perform really quite well as well.
And Dr. Walensky, as you know well, the CDC has been criticized for mixed messaging throughout the course of this pandemic, whether it's on masks or on boosters. Why should Americans trust the CDC?
My job right now is to take all of the science and the information that we have and to deliver guidance and recommendations to the American people that is adapted to the science at hand. This pandemic has given us a lot of new and updated science over the last 2 years, and it is my job to convey that science through those recommendations, and that is exactly what we are doing.
Dr. Walensky, we always appreciate your time and expertise. Thank you very much.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.